UOCA. Ocala.
All right, 6 minutes after 11 o'clock. Thank you for tuning in. Every time we have a doctor on or an expert on cancer, I always hope I'm going to hear, well, we found a cure now, so we don't have to talk about anything else, and then just close the shop and go home. I don't think that's going to happen. There's always going to be something else, isn't there? But you never know. Dr. David Spigel is on the phone. I hope I said his name correctly. We'll find out in a second. He's a board-certified medical oncologist and the chief scientific officer and the director of the lung cancer research program at Sarah Cannon Research Institute, speaking to us about a new anti-PDLI cancer immunotherapy to treat non-small cell lung cancer, and it's called Tecentriq, I think, if I'm saying it right. I have a few pronunciations I need help with, it looks like. Dr. David Spigel, good morning, sir, and please correct me if I'm saying your name wrong.
Well, it's not a big deal. It's Spigel, but thanks for having me. And let me just say, although we don't talk about curing people with advanced cancer, whether it's lung cancer or another kind, I'm telling you, we're seeing things we've never seen before, and it's not hard to imagine a future where that could happen for some patients. We're not quite there, but we're seeing some amazing things already.
So why don't we use the word cure? And if Robin, if you don't mind, I'll bring it up.
Maybe just to talk a second about that. I mean, cure implies that there's no cancer in the body and it'll never come back. And what may be the case with things like immune therapies. So these are drugs designed to boost your immune system, turn on your body's own defense, and fight cancer. What may be the case is that you keep cancer in check. So we've known this for a while. Pills, even chemotherapy is good at keeping cancer in check. What if your body's own immune system was good at not only, it'd be great if it eradicated cancer, but just held it in check? Couldn't you live a long, healthy, normal life otherwise? I mean, that's a good goal to try to accomplish.
Yeah. That's what it's all about. So, gosh, I hate to ask almost a philosophical question, but does that mean that we all have cancer?
Don't ask me that question. I mean, it is depressing when you look at the numbers. If you just look at lung cancer, so 225,000 men and women every year are diagnosed with lung cancer. I mean, it's a pretty common situation, affecting a lot of people and families. Who knows? I mean, you can look at statistics, and I can make it depressing or kill a party conversation.
No.
Let's just say cancer is very prevalent. But there's a lot of reasons to be hopeful.
Well, I didn't mean to do that. I was just looking at the philosophy behind. I want to mention to you, Robin's husband had lung cancer and had his lung removed, right?
Yeah, the left one.
And so they say he's cancer-free for how many years?
6.
For 6 years. But we don't want to say he's cured. That's, I guess, what I wanted to get to.
Well, I tell folks, you never know. I mean, as you go down this road and you pass these milestones or mile markers, I mean, literally every day where you don't see cancer is a day in your favor. And, getting to 6 years is fantastic. It may be that he's cured. You just wish you knew when you cross that line and you can say goodbye. I don't have to worry about this again. It is hard to know.
All right, I said your last name wrong. How about Tecentriq? Did I say that right? What is that?
Well, it's not like it's in Webster's, but it goes by Tecentriq, so I think you got it right. It's a drug from a company called Genentech, and it's one of the immune therapies. It was just approved in lung cancer. We have some other immune therapies approved in a variety of cancers, including lung, but Tecentriq was just approved in lung cancer. The way it turns the immune system on is a little unique, and so it's kind of N of one, or it's only medication in its class that does it this way.
So the immune system is, in the perfect specimen human being, the immune system would keep all cancer cells in check, right? So they would never, I guess, expand or whatever they do, multiply or become deformed. What happens to them?
Yeah, I mean, we're still it's hard to believe after decades of research, we're still in our early period of understanding how things all work. But you're right. In general, how is it you have an immune system that protects you from viruses, the flu, pneumonia, and yet cancer finds a way to survive? And it's very complicated, but one of the ways they do that, cancers do that, is they evade detection by applying the brake to the immune system. And it's complicated, but if you think of the brake as being a foot, or having a foot, from the cancer extending to the brake on the immune system. That foot has a name we call PDL1. And so what Tecentriq does is it blocks that foot. It's called a PDL1 inhibitor. So if the cancer can't press on the brake, the immune system is free to kind of rev up, wake up, and do what it's supposed to do.
Ah, okay. I sort of think I understand what you mean.
Mm-hmm. So what are the... Is it the same gene type when children get cancer as adults, or are they different?
Lung cancer, it tends to be a cancer of adulthood, although we certainly take care of very young people. It's very unusual to talk about a child with lung cancer. I don't want to say it never happens, but usually this is a cancer of adulthood. We certainly care for people in their early adulthood, in their 20s and 30s with lung cancer. It's unfortunate that that's the case. You bring up a good point, too, about, often we think of lung cancer as a cancer associated with smoking. As you get older, it's something that happens. And that is true. Smoking is the number one cause of lung cancer, but there are a lot of folks who don't smoke who get lung cancer, so it's something we worry about for everybody.
Are you okay with taking phone calls?
Sure.
Okay, let me get a couple of these, or at least one. Good morning, you're on the air. Thank you for calling.
Yes, thank you, and good morning, doctor. See, there's kidney transplants, heart transplants, liver transplants. What about the lung?
Yeah, it's a great question. Great question. We hear that a lot. The problem with lung cancer is by the time you find it, it unfortunately has spread to other places. So you can take out a person's lung and cure them, as the case we just discussed. When it's in the lung, that's the number one way to treat somebody. But if it's already spread and you replace the lungs, you're not doing that person a good service. So the lung cancer transplants, or lung transplants, I should say, are very high-risk procedures. And to go through that very high-risk procedure only to have cancer kind of be somewhere else in the body, come back and involve those lungs, is not going to be a good outcome for that patient. So we haven't evolved to that point yet. Same is true for other transplants. We tend not to transplant patients when they have cancer that's already spread.
Thank you for the call. I want to make sure that the listeners know where to go for more information. And are we focusing on Tecentriq?
Well, I'm happy to talk about anything. I mean, that's the recent immune therapy that was approved.
Okay.
There's a lot of good places for information, so your doctor's the first place. A lot out there on the internet. I don't want to limit it to just a few places.
Well, and that's why I was asking, because I'm imagining, okay, somebody who's listening who's really wants to know more about this. Do they go to the doctor? Will their doctor already know about this immunotherapy, or is this something?
Yeah, and if they don't, you need to keep driving. He or she will know about this. It's been around for 2 years. They've tried immune therapy. A lot out there, certainly on the internet, cancer.org, lungcancerfoundation.org. But again, it'd be hard for me to be comfortable with a situation where you're walking into a doctor's office and they don't know anything about this. I mean, everybody knows about this.
Yeah, so you don't want to bring in the doctor, the website, and say, here, look at this. Tell me, what do you think? Will this help me?
Hey, you know what? I love it when people do that. That's okay. Don't feel bad about that.
Okay. Somebody who has not had cancer for 6 years, Robin's husband, for example, would he benefit from an immunology or whatever it is, immunotherapy?
It's a really good question. We don't know yet. We don't think so. I mean, hopefully he's been cured, and it sounds like you guys are doing all the right things with watching him closely. So not really a role yet for immune therapy in that setting, although it's being studied right now. There's an ongoing study looking at a drug like Tecentriq in patients who were just diagnosed and had surgery versus not getting Tecentriq. But we're still a bit away from knowing its value in patients with what was called early-stage lung cancer.
Okay.
Wow.
Dr. David Spigel, thank you for being on the air with us today. We will put this interview up on the internet so you can share it with somebody who will benefit from it. Thank you, Doctor.
Okay, thanks for having me.
We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Plenty of sunshine continuing this afternoon, high 69 to 74. Clear and cold tonight, low 40 to 54.